COVID-19 infections are soaring in Michigan, where officials have been reporting more new cases than any other state in the U.S. Over the last 2 weeks, there have been more than 91,000 new confirmed cases of COVID-19 in Michigan, and unlike earlier on in the pandemic, it is now younger and middle-aged adults filling up hospital beds. Joining us now to discuss the latest surge is award-winning investigative healthcare reporter at the Detroit News, Karen Bouffard. Karen, great to see you. So right now, more than half of the country's adult population has been vaccinated, and most states are seeing a drop in infection rates. So why is Michigan currently the national hotspot for infections?
I think that's a question that a lot of people are asking. One explanation that I've heard is that we have a large Arab American population in the city of Dearborn, and we have a lot of international travel to and from the Detroit area. We have a major hub in Detroit Metro Airport. So that is one of the things that I've heard. I think we were a little bit slow coming out of the gate on vaccinating people. We were kind of one of the worst ones in the country to begin with. At the beginning, I think that our vaccination rate has improved a lot. We're now vaccinating, we now have about 56% of adults vaccinated in the state. I'm sorry, about 33% of adults vaccinated in the state. So anyway, we're coming up, we're improving, but I think we were a little slow out of the gate on that.
I think a lot of Americans who have not been to Michigan, they're going to recall over the last year, all those men sort of showing up, men and women showing up at the state capitol, rejecting the COVID restrictions, masks less and all that sort of stuff. And they're going to wonder if that sentiment played a role in what we're seeing now in Michigan. From some of the stuff that I read, it seems like that might be a factor, but then there kind of are a host of other factors too, including, the behavior of people in more rural areas who, quite frankly, during the last surge really weren't seeing COVID cases, so perhaps didn't feel like there was a legitimate threat to them.
That's all true. I would agree completely with that. I think that one of the things that Governor Gretchen Whitmer has said, and when she's been confronted with the idea of, why aren't you closing things up in Michigan? What she has said is, we don't have a policy problem in Michigan, we have a compliance problem. And that is very true. We have a lot of people in Michigan who really don't want to mask up. They are, opposed to closing up, and, so I'm sure that plays into it.
So hospitals in the state now are in danger of being overwhelmed, and it's younger adults who are being admitted with some serious symptoms. Again, I guess trying to understand what's behind this trend is difficult, and it's complicating. But I remember here in New York City when hospitals were under the strain, and it was eerie. It was scary, for lack of a better word, to be stuck indoors, and the only sound that you hear outside are the sound of sirens of ambulances on their way to the hospital. And then I would sometimes take walks outside into Central Park and see makeshift hospitals set up in the park there. What's it like in Detroit right now?
I would say that it's not really as you described. It's not like it was in New York. There's still people out and about. There's still, commerce going on. We do have a huge vaccination effort going on at Ford Field in Detroit. We have mobile vaccination units that are going into the neighborhoods to vaccinate people. So there is a lot of activity around trying to get people vaccinated, trying to get people to, comply with masking and social distancing and those kinds of things. But in terms of what we had a year ago, when we had a total shutdown in the state, it looks much different than that. I mean, we're really kind of back to business as usual in terms of, how it appears, people out on the streets, et cetera.
So one of the things that we've been seeing across the country is that among the people who are getting COVID, it's sort of younger people. And it kind of makes sense if you think, many older people are getting vaccinated. But what you guys are seeing is an increase in hospitalizations among children. The Michigan Hospital Association reports the number of pediatric patients between February 19th and April 20th jumped 17 to 70%. That's about a jump from 17 to 70, which is a 311% increase. Lots of numbers there. But the idea is a lot more kids are getting sick, so sick they have to be put in the hospital. Do experts know why? Is it that, just adults maybe are not as vulnerable because people are getting vaccinated? Or is it that the kids are, heading back to school in Little League and so their exposure is up?
Well, what I've heard is that it's exposure. There's a lot of cases that have been tied to school sports and so forth, clusters tied to school sports, tied to in-person classes. Also, we have to remember that children aren't vaccinated. And in some parts of the state, there are, large numbers of people that aren't vaccinated. So the other thing to consider also is that children often are asymptomatic, so they can spread it very quickly to other people, to other children. So one thing I do want to mention, though, is that there is the danger with some children of developing the syndrome where they have inflammation, throughout their entire body. And that is one of the things that lands some kids in the hospital. It can be a very serious situation. Fortunately, I don't believe that it results in deaths. I don't believe that a high percentage of these children die, actually, although it's possible and it has happened. But it's a very serious illness, and it can take kids a long time to recover.
So you know that 2 weeks ago, CDC Director Rochelle Walensky said that Michigan should shut things down in order to get a handle on rising COVID cases. This has been an interesting discussion, as you know, over the course of the entirety of the pandemic, right? Whether or not these shutdowns actually work, whether or not the fact that they are, that our medical professionals suggest them and that governors follow along with them, which subsequently leads to more problems down the line. Children not being in school, businesses going out of business, people losing their jobs. And it's not clear yet. I think the history is still unclear as to, when we look back at this pandemic, if some of these, forced shutdowns will have worked in the way that some of the medical professionals suggested that they might. So how has the governor responded to those recommendations from the CDC?
Again, one of the things that she has said a number of times is that she doesn't think that this is a policy problem. She thinks that it's a compliance problem. And so the governor is kind of staying the course in terms of leaving things open that have already been opened up. And she doesn't appear to be interested in backtracking and kind of reversing some of the openings. So I think it's a very delicate balance for her because, there has been a lot of political backlash in Michigan by people who really thought that she overreacted and were really opposed to the shutdown that we had, because we had a very, very strict shutdown for a while. But on the other hand, you can see what happened in India, for example, where, they opened up too fast. And, now there's a huge problem going on there. So, I think all of the governors, have to strike a balance between, what do we do for the economy? What do we do to prevent disease? So, but her stance at this point is we're going to stay the course, and we're going to, continue hoping to open up and not reverse what we're doing.
I know at one point the governor asked for more vaccines, that if any state or if the federal government had leftover, they should send it to Michigan. That request was rejected, and the argument was basically it's going to take, weeks and weeks before you see the impact of the vaccine. You need to do something now in your state, which is, shut things down. Sometimes we've seen, though, the argument against restrictions at times dovetails with the argument against vaccines, or not trusting the vaccine hesitancy. I'm wondering, what are you seeing in terms of the rates of vaccination? Are people still enthusiastic about getting the vaccine when their opportunity comes? And what is the state doing to encourage people who may be hesitant, to encourage them to get the shot?
We do have, a significant percentage of people in Michigan who say that they don't ever want to get vaccinated. The vast majority do want to be vaccinated, but we do have a significant number that are opposed to vaccinations. So, and I think what's happened in the last week or so, what we've observed has been kind of a slowdown in the number of people who are getting vaccinated. So more at the community level than the state level, health leaders and, city leaders, et cetera, have been coming up with incentives to get people to come. Like, for instance, Wayne State University is offering a $10 meal to students that come, and we show their card, that they've been vaccinated. And there have also been a lot of places that have opened up to walk-ins so that people don't have to schedule an appointment. Even Ford Field, where they are hoping to vaccinate about 5,000, people a day, they are just taking walk-ins now. At this point, I mean, you can schedule an appointment, but you don't have to have one anymore. So, but those are things that are happening more at the local level than the state level, to just kind of, I think the sense is that we've gotten the low-hanging fruit. We've gotten the senior citizens, the more elderly people who are the most vulnerable. A very high percentage of that portion of the population is vaccinated. And now, we're down to a tougher segment of the population. We're down to people who either don't really care, maybe they're not thinking about whether they should get vaccinated, or people that are actually opposed to vaccinations. So it's going to be a tougher, a tougher job at this point, going forward.
Yep. I mean, it's not just in Michigan, it's across the country. There's that core group of people that still remain unconvinced. Karen Bouffard, thank you.
Thank you.